Hello, everyone. Welcome back to another episode of 5 Minutes in GI, the show where we try to answer the most frequently asked questions about gastrointestinal disorders in just 5 minutes. I'm your host, Alyssa Sutton, and I'm the program coordinator for the International Foundation for Gastrointestinal Disorders. Today, I am happy to welcome Dr. Iris Wang. She is not only one of IFFGD's junior academicians, but she is also a GI specialist at the Mayo Clinic in Rochester, Minnesota. Her focus is on GI disorders like GERD, constipation, diarrhea, and other pelvic floor disorders. So I just want to take a minute to thank you for being here with us today.
Thank you so much for having me, Alyssa.
So today's question is, what are the greatest risk factors that are related to GERD?
That's a great question, and I'm really excited to answer it because I think there's a lot of misconceptions around what is GERD and what is reflux and how does that differ from indigestion. And so I'm going to go ahead and share a slide that I think is really helpful because I think it's helpful to know what is actually happening when we experience reflux, what should happen so that we don't experience reflux, and so then what can go wrong.
Right.
And so here, what we can see is that in a normal stomach, there's a lot of acid that gets produced in relationship to what we eat and when we eat. So this acid gets produced to help us digest our food, and that's a completely normal process. You can see that with this acid being here, our esophageal sphincter from above should actually be closed so that all that acid stays in the stomach and then moves forward. But once in a while, that lower esophageal sphincter actually opens. And that's actually a normal process as well because it allows us to vent some of the air that gets created in the stomach as the acid sloshes around with the food. And then with that, inevitably, a little bit of acid actually gets back up on a normal basis to enter our esophagus. So then the question is, if this is normal, what actually happens in reflux disease? Well, in reflux disease, that backflow of acid and kind of stomach content happens more frequently and can actually cause damage to our esophagus. And so, what are those risk factors? Well, first, we want to know why this actually happens, right? So, one thing is normally acid gets into the esophagus, and our saliva that we swallow can actually help clear that acid away. And so, if we have decrease in the ability to get rid of that acid, then we're going to see more damage and we might feel more symptoms from GERD. And we're going to talk a little bit more about which diseases contribute to which of these mechanisms. The second one is this lower esophageal sphincter we talked about opens on a regular basis to help us vent after we eat. But if that happens more often, if what are called these transient lower esophageal sphincter relaxations, if that happens more often, then we're more likely to experience acid reflux coming up. And then when that reflux comes up, if our tissue resistance is, if that barrier on our tissue is not as strong, then that acid might cause more damage.
Mm.
And then if we have decreased muscle tone, that can also contribute to that muscle opening more often. We can have increased gastric pressures. So if there's more things in the belly pushing up on the stomach, whether that's because the food's staying there too long or because we have increased pressure in our abdominal cavity from things like fat around our organs or even straining to have a bowel movement, that can push the acid back up in an acid sort of physical mechanical mechanism. And so, with all of that kind of understanding, we can now go back and talk about what are the risk factors, right, that contribute to these conditions. Well, with our esophageal acid clearance, things like smoking and diseases like scleroderma can decrease the amount of saliva our mouths produce. And so that makes it hard for that saliva to clear the acid. Things like connective tissue diseases like scleroderma can change how well our esophagus contracts to clear the acid. And so that can worsen reflux disease. With things like gastroparesis, that slows down the emptying of our stomach and increases pressure. But the more common contributors to reflux are actually obesity and constipation, because with obesity, there's a lot more pressure on the belly and on the stomach from the outside. And with constipation, when we strain or when the bowel movements take up space in that abdominal cavity, that can worsen reflux. And lastly, here, medications like baclofen, having a hiatal hernia, and smoking can actually increase the amount of opening of that lower esophageal sphincter, and that causes more reflux. So those are some of the biggest reasons and biggest risk factors for reflux, and that's a little bit about why.
Thank you so much. That was actually really helpful. I appreciated the visuals because I had no idea that all of those different disorders could actually contribute to producing either more acid or make it less likely that you're going to be able to
Mhm.
input that saliva to help decrease that acid. So that was very, very helpful. I actually have a question, if that's okay.
Of course.
Um, I know in terms of like smoking, some people may do it part of their life or, they may quit. Even like gastroparesis, their symptoms may become more manageable. In those situations, does something like the LES actually fix itself instead of staying open? Is it able to kind of go back to the way it was?
That's a really great question, and I think it's a little bit individual depending on how long those risk factors have gone on. So, in the case of something like gastroparesis, once the gastroparesis symptoms are better controlled and food's moving forward a lot better, similarly with constipation, once things are flowing a lot better, we actually do expect that the reflux improves because that physical pressure is no longer there. Weight loss is a big component and a big way to fix reflux. Smoking is a little bit more challenging because it's not as at least I don't know the cutoff of whether you smoke for a decade if there's permanent damage, right? But what
Right.
we do know is that the toxins in smoking, in addition to that increased risk of reflux, puts folks who have both those conditions at higher risk for developing precancerous lesions and having more complications from the reflux. And so certainly being quitting smoking is something that we would highly recommend, not just to control symptoms but to prevent downstream consequences.
So that's actually all the time that we have for today. If you're a patient that is struggling with GERD, make sure you check out IFFGD's complimentary fact sheets by visiting our publication library at www.iffgd.org or by using the QR code above. You can also find more information that is related to GERD by visiting our website at www.aboutgerd.org. And as always, if you have any questions after watching today's video, please feel free to email us directly at iffgd@iffgd.org. We'll do our best to answer any other questions that you may have in another episode of 5 Minutes in GI.